If you've ever struggled with whether to automate a customer touchpoint or keep it human, if you've wondered how to measure the personal side of your product experience, or if your team debates where AI helps versus where it hurts customer relationships, this discussion is for you. We'll examine how companies dominate their markets through product innovation and customer experience that create loyal fans, with a focus on One Medical, a startup that Amazon acquired for $4 billion. Our guest is Dr. Joseph Michelli, an internationally sought-after speaker and organizational consultant. He is also a New York Times #1 best-selling author who has spent his career inside the world's most customer-obsessed companies, from Starbucks and Ritz-Carlton to Mercedes-Benz and Zappos. His latest book, All Business is Personal, examines the human-centered approach that made One Medical stand out in healthcare. If you're listening to us and would rather watch the discussion, go to our YouTube channel. Simply search for Product Mastery Now on YouTube. Let's jump in right after this.
How can you unlock your full potential as a product manager? We're sharing the product management insights you need. They are based on the 7 research-backed knowledge areas for product mastery. You'll learn to create products customers love, enhance your influence, and elevate your career. Welcome to Product Mastery Now, hosted by Dr. Chad McAllister, product management professor, practitioner, and your guide.
Joseph, thanks for joining us.
Well, I missed you. It's good to be back with you, Chad.
Likewise, we've had the pleasure of talking about some of your deep dives into companies. And I like that this one, that they all have an innovation element, which is what we're about here, product innovation, service innovation. This one is a little bit more obvious to me, and I don't know why it's there too, but stands out in the customer experience context. I kind of like to know, what is the thread that you see between your work? Because you've done a lot of deep dives, right? There's Ritz-Carlton, Starbucks, Mercedes-Benz, Airbnb, Zappos, the Pike Place Fish Market.
Yeah, that's a hard one for people who live in Colorado.
That's right.
Who live mountain up there instead of the Pike Place Fish Market. Right. The common thread is I consult for all these companies. So that's the starting common thread. All of the companies had at some level a desire to make what they had better, which I think some companies are very complacent and they're living in the yesteryear. But there are a lot of companies who are constantly looking for how do we push the envelope as it relates to being more relevant to our customers. And so all of them have that in common, and they brought me in, and then I had the good fortune of working with them, and these are normally the ones who do well, right? Like they're those clients that we don't write about, and there are clients that would be wonderful to write about, but their story isn't big enough maybe for people to really grab onto. So they all have a story that I think is about making the world better through service experiences to their team members and to their customers, and they normally have a global impact in one way or another.
Right. Okay. So the key thing there is desire to be better. And obviously, part of that being better is a customer-focused perspective as you dive into the customer experience. When it comes to One Medical, just saying that this is the startup that Amazon acquired for $4 billion kind of gives it a size of importance. They're a healthcare company that I don't think anyone, well, I should say anyone, wasn't on my radar for sure, right, before Amazon acquisition. What made you get involved? I mean, obviously they must have reached out to you. You got involved with them at some point, but why is this the topic of your most recent book?
Yeah, so this is not a household name, and that's always a little bit scary for me because I'm much more inclined to want to write about Mercedes-Benz or Zappos or some company that jumps to your mind like Ritz-Carlton. But the reality is I worked with the chief operating officer when he was at UCLA. Well, he's actually the CEO of One Medical, but he was the chief operating officer at UCLA when I worked for him. He went on to be the CEO of Stanford Health System. So he's a pretty well pedigreed guy from the standpoint of healthcare leadership. And he called me to work with him at One Medical before COVID, trying to get really more technical lift and more innovation. And we did that for a number of years. We were well positioned when COVID came to be ahead of the power curve. And then ultimately when they got purchased by Amazon, he was really ready to start telling that story more broadly, and we brought it to market.
Okay. Give us a sense of who One Medical is, just so we have a little bit of context.
Yeah, it is not known to everybody, though it's a part of your Prime membership opportunity. You have to pay an add-on to it, but it is a membership service just like Prime is, and there's a small monthly fee if you want to add it on. I'm not here to sell you on them, but I am here to tell you a little bit about them because I think they're a model for what we can all do to innovate. And to your point in the beginning, to address the issue of how do we blend AI into the service delivery. But One Medical is a startup by a guy named Tom Lee. Talk about an innovator, Chad. Tom came out of medical school at Harvard. Then he went to Stanford Business School. And while at Stanford Business School, he did the classic MBA project, and it was a software called Epocrates. And software is kind of a gentle way of saying an early app for the BlackBerry. And if you think about it, in the old days, your physician would have had on their desk something called the PDR, the Physician's Desk Reference. Right. And it was this big blue book with all the medical drug interaction kind of stuff. Well, this was the first attempt to put that in a digital platform, and people could go on their BlackBerries and find out what the drug interactions were, much more in real time and much more updated than that book, which was published every 6 months or so. So that was the beginning. And he said, innovation in product is awesome. I love innovation in product. But I also want to revolutionize healthcare, and this product innovation isn't going to do that. It's going to help save some lives, but it's not going to innovate the way people receive healthcare in a broken system in America. And so he went on and opened his first primary care clinic in San Francisco with a lot of technologists from the Bay Area, and they just kept innovating. And that is what was created to build something that Amazon found an interest in.
And as listeners often know, I think you may recall, I do my best to not read books, including yours, but I do skim through. That's because I'm more curious when we get to talk, right? But I did notice, because I wanted to find out a little bit about what makes One Medical stand out, just some simple things that are in there that drive all of us crazy when we have to go into a medical clinic, like sitting in the waiting room for a known amount of time before someone even pays any attention to you. And then you sit once you get through the door, right, you sit in an exam room for a known amount of time waiting for someone to pay attention to you. It's
the double wait.
Medical, right?
Dun, 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 the double wait. Yeah, it's totally redesigned. So this Tom Lee said, why do you have to do that? Why in the world must you have to wait twice? Like, what is because we've always done it is pretty much the answer. And it somehow seemed to accommodate the busy physician schedule. But it's not very human-centric in its design. And worse yet, even if you step back a little before that, for a long time, the only way we could make an appointment was to call in during regular office hours, right? I couldn't make an appointment in my jammies looking at a provider's schedule to know when they were available. So this was just really draconian stuff. And so it started with being able to have every primary care provider in your clinic's schedule available to everybody to schedule on whenever they wanted to schedule on it. It starts there. Then you schedule that appointment time, and at One Medical, 97% of the time, you're going to be seen within 3 minutes of that time. I mean, you think about it, there's a lot of companies that are offering guarantees if they don't see you within some kind of bandwidth of when they promise to be with you, but healthcare could care less for the longest period. So now One Medical is going to honor that appointment time. And when you are sitting down for that 3-minute time, assuming you arrive right on time and they're within that window, then your provider's going to come and get you. And you missed a pain point. I seldom correct you, Chad, but you missed a pain point. Because once that provider, whoever got you, normally it would be a physician's assistant maybe or someone in the staff, they're going to walk you by the scale. Now that's a pain point that most of us appreciate. Now, assuming that I'm in for a cough or a cold or a flu, the weight is not a relevant clinical variable, and it's an annoying pain point that isn't necessary. Now, if it's your annual physical or weight is a consideration, I got Govy, well, that's a different story, right? But this is just, why do we do it? Like, does it really add value or not? Which is what I think great innovators are always asking. Is this a value add or not? And then when you're innovating, it's a lot of iterative design, but they were really going for what I think is completely different than what a lot of innovators do, which is let's optimize the design. Let us take a blank slate. Let's do our dangest to think of the way it should be, not the way it is better than it used to be. So to me, that's a big variable. The constant asking why. Why do we do this? Why do we do that? Why do we do this? Was enough to keep causing him to try new ways to service deliver. And it was compelling enough that people were willing to pay for this. Now, let's get this straight. They do not do anything different when it comes to billing. They're still taking traditional health insurance. So it's not like by going to One Medical, your health insurance isn't activated. It's the same reality on that side. But here is what is different. You're going to get same day, next day appointments. You're going to be able to schedule those appointments at your convenience. They're going to show up when they're there. All those things we've talked about. And you're going to communicate with your provider through an app that allows you to really be effectively communicated with. And that's as simple as some things as like if I write a question about billing, the technology and the AI is going to route that into the administrative queue. Whereas if I mention sniffles, the AI is going to send it over into the clinical queue. And all of this is the innovative nexus that Amazon purchased for $4 billion.
Okay. It sounds like a much better experience, right, for anyone listening that has access to a One Medical clinic, but there's online resources too. Back to kind of the innovation part of this and customer experience. I did see a quote, I think it was from Laura in the book, that is the head of design at One Medical, talking about when we were designing the spaces, we designed them for employees and also for our customer, because if our employees are happier and more efficient, they can better serve our customers. There is this thread throughout, and it's not just your examination at One Medical, but I think other companies you've looked at too, this desire to integrate the employee being really engaged in their work to better serve the customer. Can you talk about that relationship and just how you see that show up?
Yeah, I think it's really important in healthcare because we're going to have a healthcare shortage, particularly in primary care. If you're going to attract the best and brightest, you're going to have to create a work environment where they can survive and where they're not cannibalized. If you look at how many physicians were doing jammy time, where they were doing their medical records and notes in their private time at home, you understand the quality of life for them is really deteriorated. And as a result of that, they're burning out and they're leaving the profession, and a lot of new people aren't backfilling. So I think there is a real world application that if you don't create a humane experience for the people who are working inside your building, they can't translate that outside of the walls of your building. And I think they've done a great job of using their technologies to take away the mind-numbing aspects and using their UX designers or their experiential designers, however you want to look at it, to follow and track all of the movements and actions of their team members to understand how many clicks away are they from being able to affect what they need to have happen. How do we create the integrations for our teams so that they are streamlining the experience? What technologies are mature enough for us to implement right now that will make their life better, and which of them we should stay away from until the hallucinations clear up? Right. And you're seeing a lot of that. They're using AI a lot, for example, in the actual exam room, where with your permission, I'm going to use an AI tracker. Just like we're doing our recording today, there's AI that's transcribing what we're doing, right? They're using a similar technology when a patient is looking at a caregiver. And now the caregiver can look at the patient and not at the chart and not at the electronic record that they're trying to complete. So the use of that technology in the background to make life easier is critical to attracting the right people and giving them longevity in the job.
Right. I think this is kind of analogous to school teachers. Both my brother and sister were public school teachers. And as I've talked to medical professionals, right, most people get into the medical profession because they want to care for people and help people. And the school teachers do the same thing. And instead we find out once we're there, it's more of an administrative nightmare that we spend the majority of our time on tasks that we never envisioned. We were never excited to do when we went to school for that thing, right?
Yeah, how do you take a calling and just wring it out of people, right?
Right.
And it is the job of innovators to say, I'm going to find a way that retains the soul of this care provider or this teacher. That's why I love innovation. I mean, I am totally in love with people who spend their time thinking about why are we doing this and what might we do to make it better. And the reality of design is that it's the might and what's possible that we can do, right? Like it's both what might we do in a hypothetical sense and what from a pragmatic sense could we even begin to embark upon. When we bring those two factors together and we take a step in that direction, then we can start looking at the data and the feedback, and then it's good to iterate, right? Like it's good to iterate into greater and greater and more effective solutions.
Yeah. I'm getting more and more excited about this story in the book as you talk about it. One, your strength as a speaker and author just came clear. You summed that up much better than I was trying to when you said taking your calling and wringing it out of people. We need to think about designing jobs for the people doing them as much as for the customers that we're serving, and both are very important. Speaking about designing and innovation, back to how did you see One Medical put innovation into effect? You talk a little bit about design thinking in the book, and IDEO's made that popular through D School at Stanford, but obviously they have some framework in place. They must be delivering on it.
Yeah, I think I spent way more time in this book talking about design theory than I normally do because I always worry that it sounds wonky or it's because I like it so much that I'm going to talk too much about it. But I think not only do they take the basic principles of design, which we go into in great detail in the book, but I think they also have used lean technologies, for example. They do walks to Gemba. They do all of the sort of things that keep people engaged in being problem solvers. They have the task boards, their daily meeting boards with the problems they're solving at a macro level, micro level. They're able to identify what are they trying to solve in the clinic today, what needs to be escalated up to the next level of meetings between the office manager and their regional teams. They use things like customer walks. I use that term a lot more from a Starbucks world, but clearly they're getting people to walk in the shoes of the customer, literally physically standing where customers stand, looking at them, listening to what customers are saying. And they're also doing rounding, where somebody who might be responsible for front desk is now rounding in the phlebotomy suite to try to understand what they see as not an insider, but kind of a pseudo insider, and be able to really look at it somewhat differently. So yeah, they do a lot of looking at, asking questions and identifying problems, and then using design theory to try to come to solutions and escalating to other teams that are specifically tasked with solving various challenges.
Yeah, I like that notion of the job rounding, right? The taking people that are out of their normal role and going to visit the customer in a different capacity, different environment. It gives you a better appreciation of what we're trying to actually do for the customer.
I first saw this at UCLA, literally where the CEO would round with the housekeeping lead, and they would go to different areas of the hospital. They'd talk to patients, and they'd all come together after they did this observational space, and they'd share what they observed, the things they fixed in the moment. There wasn't a certain kind of newspaper available. They were able to just locate one and bring it. There's some solving of that immediately. And then what did they identify on their parking lot list of things that they needed to start to get to?
Yeah, good. And once again, that continuous improvement sort of notion, right? So they've done a lot of customer research to put in place what they're doing now, but they're not resting on that. It sounded like they're still involved, empathy being a big aspect of this, walking with the customer. What is it like to be in the customer's shoes, and continuing on with that. In healthcare, you mentioned task boards. Often there's the huddle board.
Yeah, that's what
Did you
it's
see
called.
that? I was just wondering if that was a thing.
Yeah.
Basically, the whiteboard or the one-page canvas that says, hey, here's the things we're looking to improve right now. How are we doing, right?
Absolutely. And key metrics for the day, and shout outs. The boards are really well organized. I actually have a depiction of one of them in the book. But yeah, I think all of that is the way that we keep in front of people our current state and our challenges. And we engage people in regular dialogue about how they play the most important role as spotters and solvers, because managers don't have all these solutions. And the people who are closest to it, I have a buddy who is one of the founders of Starbucks. His name is Howard Behar. And he says, the person who sweeps the floor should buy the broom. It really should be that person who understands what is needed, not some senior executive somewhere in finance approving the requisition.
Right. Which is there's also, I suspect, One Medical is an organization, as is Ritz-Carlton and others that you've written about, probably where people are empowered when they see the dumb thing going on to be able to immediately take action and fix that and try to make that go away in the future.
Easier to get forgiveness for trying to do something right for a customer than forgiveness for not taking initiative. And I think a lot of these organizations, obviously can do really dumb things to solve dumb problems, but normally as long as it's not malicious, your intention is graded higher than the outcome, because we can't solve all these complex problems, but we should be owning them, right? Like we should realize we can't keep looking the other way. We have a role to play.
Yeah. I had a friend that used to help leading organizations with innovation and help them, organizations that are doing well, innovate even better. And he went as an employee to Amazon for a while and said, this is the most innovative company on the planet. It's just amazing. That they are known for this ambidextrous organization, right? That there are dual operating systems, we call it. We excel at operations, we excel at innovation, we expect everyone to be really good at both of these things.
Yeah.
That's a tough environment to walk into. And I'm just kind of curious about, as an acquisition, how One Medical fits into that. It sounds like those elements were there, but how do you think culturally they align?
This is my second rodeo with a company being acquired by Amazon. I used to work with Zappos, and they got acquired by Amazon. And so I'll tell you, I think that every company tells you that it's going to be gentle and we're not going to change anything when they're coming in on the acquisition. And then shortly thereafter, a lot changes. Amazon is really changing a lot with One Medical, as they did with Zappos. I think the challenge for them is to figure out when not to change something, right? Because there's no way you're going to do better than the supply chain of Amazon, and Zappos picked up a lot from that. But when you got to the contact center for Zappos, which they call the customer loyalty team, they were far better than the contact centers at Amazon. And that's saying a lot, because Amazon does a pretty good job when you have to opt for a human. But Zappos had more of a personal, emotional connection in the way they engaged customers on the customer loyalty side. In this journey, it's interesting because Amazon doesn't really have a business that relies as much on people as One Medical does. I mean, it's almost the entire product is the human service interaction and healthcare expertise of the provider. It's not a supply chain play. That's not to say technologies can't make it more available and accessible and manage pricing and all that, but it's very different. So I'm watching this one with lots more amusement, in the sense that there is a lot of juxtaposing and positioning and figuring out, what do we not change, because that's what we bought. We want to take that intelligence and bring it over into maybe some other businesses. Then the most expensive acquisition Amazon had was Whole Foods, which is still very supply chain heavy, but has a lot of human interaction to it.
Right.
So it's interesting to see. I know some of the things that happen there, and I assume that Amazon's going to pull some of the best of One Medical over.
Yeah, it sounds like at least they're aligned on the customer is very important to us. We want to do the right thing for everyone involved, and we'll see where that goes. But amazing story, right? That this startup, the Amazon acquisition, there was some news line I think I saw recently on CNBC about someone talking about that Amazon is going to be the future of healthcare.
Yeah. Well, let me give you my scenario. So the use case for One Medical, and the thing we probably didn't really get clear about was that, so if you're still paying your insurance, and what is One Medical? Well, people wanted all those benefits of using the app, the same day appointment stuff. And so this Tom Lee guy basically said, hey, would you be willing to pay me for it? This is a concept that I really go back to Gilmore and Pine, who wrote The Experience Economy. It's almost like, do it so well that people will pay to see you do it, right? And it's what they pay for is what they value. So he said, will you pay me to just have the app and have this easy access and this more comfortable position? Is it kind of like a semi-concierge medicine thing? And if so, what would you pay me? And initially, this was before e-commerce, he said, just send me a check for $39 a year and you'll be a member. And then some people did and some people didn't. I assume back in the day, he probably didn't care. He just got some capital from that. But over time now, it's like, I don't know, it's probably $89 a year or something to add it on to your Amazon Prime, maybe about $8 a month. And the value proposition is, I go on my app right now, and let's assume I've just traveled to Colorado, where you are from Florida. I'm not feeling quite right, maybe scratchy throat. I'm going to go on my app. I'm going to use my app to triage my symptoms, not go to Dr. Google and convince myself I'm about to die, but have a curated triage experience. It's going to then help me determine what level of care do I need. And if they say, you should really get treated now, push the button, I'll push the button, treat me now. Maybe 3 or 4 minutes later, on my same app, there's going to pop up that provider. We're used to telemedicine, so that's not shocking. Right. But think about what's happened in the routing. I'm in Colorado. They had to find a Colorado provider. They located that provider. They've connected it. They're looking at my medical record to my primary care physician and all the other care I've received, not some insurance company virtual care provider that doesn't have any connection to my actual record. And now they're going to say, you know what, Joseph, based on your symptoms, I'm going to send a medication over to you, to your hotel. And since we're imagining I'm at the Broadmoor today, they're going to send it to the Broadmoor, and they are going to do that via Amazon Pharmacy. So that medication is being shipped to me. Now, the use case really speaks convenience. It speaks to digital integration. It speaks to a well-designed, well-curated experience for a specific use case. And I get that for $9 a month, which I can pay as I go. So let's say if I'm traveling, I might take the $9 monthly subscription and cancel it next month. You following me here? I think that's where this innovation is coming to fruition and integrating with the best of Amazon.
Yeah, no, that's huge, right? The appeal of being able to book it in next day, that's amazing. But for the person who's traveling, for the mobile worker, this podcast started out originally as being on the road with my wife and 2 kids for a year and 2 weeks doing the RV thing. And this is the sort of scenario we ran into periodically. Like, someone gets sick, what do? We go to the emergency care that we find in the area. They don't know anything about us. That's a much more integrated experience that you just described. That's very appealing. So
yeah, and you might have been routed to, if they had a primary care facility in that region, they might have sent you right over there. that
Yeah,
day
right.
to be seen as an alternative to urgent care, which again saves healthcare costs, which is all part of why the other providers in the space kind of like this player too.
Right. Yeah, very interesting. I had no intention of looking into it as a customer, but I think I will now because I appreciate the innovation.
Can you just let
added.
Amazon know you bought it for me and maybe they'll give me
Right,
a commission? Because I'm certainly not getting commissions from this stuff.
You got to work out a deal.
I got to get there.
Definitely. Okay, really enjoyable conversation. Love the customer-centered perspective there at One Medical, their perspective of taking care of employees as well as they want to take care of customers and just adding value along the way to what we're doing. We do like innovation quotes. I asked you for an innovation quote that you can share and what that means. You got something for us?
Yeah, I don't know who said it, though. This is kind of my problem. But someone, I think I saw a speaker say this. So I think they said, anyone can invent. They can go in their basement with some duct tape and some PVC and they can invent something. Very few people can innovate because innovation is taking invention and creating such value that people will want it. And for me, that is the quote that sticks with me. You can create something new, but unless you have a market for it, it's not innovation.
Right. Absolutely. Innovation couples that marketplace with it, that you're adding value for others, not just scratching your own itch per se.
Yeah.
So that's really good. So what can we expect from you next? Yeah, I know you don't
Jeez,
talk about
Chad,
these things,
leave me a break. Give me a breath. Come on. No, seriously, it's like, which child you love better? I think for me, I know I have a new book out. It'll be out in 2027. I'm currently writing it. It's about Edward Jones, the financial services institution. Specifically, it's about Penny Pennington, their managing partner. There are very few female Fortune 100 financial service executives. She is remarkable. I loved a book by Indra Nooyi a few years ago, My Life in Full. She was the CEO of PepsiCo. And this is very much the same kind of human being who's tenacious and breaks through barriers. And she's just delightful. So I can't wait to tell her story in 2027 about her leadership at Edward Jones.
Fantastic. That would be a good one to read and probably a good model that a lot of parents might want to give to their
2027, you and I are hanging out again, Chad. It looks like to me.
I would love to do it, Joseph. That would be fun. Okay. Obviously, the book, All Business is Personal, is on Amazon. You may have other places you want to send people. How can people
Why would I send that people to anywhere else but Amazon about a book about Amazon, Chad? You can go wherever you want. Any good bookstore is fine. Amazon will take your money, though, I guarantee it.
And what about finding out about the other work that you do, helping organizations, speaking on these topics?
Yeah, well, my name will be all hopefully in the show notes, and let me assure you, that's how you get me. I'm mercilessly everywhere on the internet under Joseph Michelli on LinkedIn and josephmichelli.com for my website.
Okay, josephmichelli.com, and the links will be in the show notes for this. Joseph, really enjoyable conversation. Thanks for all the hard work you do helping your companies that you work with excel to create value for customers.
Well, thanks for what you do on this podcast. I love it. I enjoy listening to you. So thanks for being here and doing this for all of us.
I appreciate that as well. So next time you're in Colorado, let me know. Vice versa if I make it to Florida.
You got it.
You take care. Have a great day. And for listeners, if you want to find the written show notes, just go to productmasterynow.com/555. If you like the number 5, that will be easy to remember. As always, keep innovating.
Thank you for listening to Product Mastery Now, where product leaders and managers gain product mastery through practical knowledge, influence, and confidence. By listening, you are becoming a product master, creating products customers love. Find additional resources at productmasterynow.com. Keep innovating.